We'll be discussing an important step in the surgery for spinal cord tumors, the pile retraction sutures. This technique, learning this technique is very important because spinal cord is very delicate. You cannot use hard instruments to retract the columns of the spinal cord. But without retraction, the normal tissue will be overlapping, will come in between, come into the field and will not allow you to dissect the tumor properly. So you want an effective retraction technique with which at the same time is very delicate and very soft on the nerves of the spinal cord. So learn this technique, the pile retraction technique. If you have any doubts, do not hesitate to ask me at the end of the session, or you can also ask me one-on-one on the either on my WhatsApp number or in the interval session. So the pile traction sutures for spinal cord tumor surgeries. I'm Dr. Kalyan. I'm a neurosurgeon and spine surgeon working in Hyderabad, Gleneagles Global Hospital. Spinal cord surgeries present challenges due to delicate nature of the spinal cord tissue and the risk of damage to the surrounding structures. Pile traction sutures can improve surgical outcomes and reduce the risk of complications. I needn't elaborate on this one. As a neurosurgeon, as a spine surgeon, everyone knows that the spinal cord is covered by three layers: the dura mater, the arachnoid mater, and the pia mater. In this session, we are speaking of the pia mater. Pia mater is the innermost layer. It is very thin and delicate membrane that covers the surface of the spinal cord tissue. Let me tell you the steps. Then I will tell you in the surgery. They are placed through the pia mater to gently lift and hold the spinal cord tissue in place during surgery. They are typically made of fine, non-absorbable materials such as a silk or nylon or proline. They are tied off to create a small loop or handle that can be used to provide a traction. Okay, so how do you actually place? You identify the area of the spinal cord where the tumor is located. Look for any swelling in the spinal cord. At the area of the maximum swelling, you can find the intramedullary tumor. Use a fine needle to pass a 6-0 suture through the pia mater, being careful not to damage the delicate surrounding tissue. Tie off the suture to create a small loop or handle that can be used to gently lift and hold the tissues in place. Repeat the process with several sutures placed along the length of the spinal cord to provide adequate retraction and exposure of the tumor. Small mosquito clamps or other instruments can be used to provide gentle, constant traction of the spinal cord tissue once the sutures are in place. So I've taken a still shot. So this is the spinal cord. I've done a myelotomy. So can you look in this picture, thin transparent layer which is shining? Can you see the shining one? Can you see the shining one? This is adherent to the spinal cord. This is the pia mater. So I've taken 6-0 proline. I've taken a suture through the pia mater under the magnification provided by microscope and the illumination provided by microscope. I will not injure the underlying the spinal cord. I take it out and I have sutured it into the arachnoid mater and the dura mater until I get the sufficient retraction. If I have not sutured, I can hold it with mosquito sutures where I can adjust my retraction as my surgery goes on. Once I have placed one place, I have placed a second suture, I have placed a third suture, if required, I'll place a fourth one. So that this technique will provide me retraction, but at the same time, it's very gentle on the spinal cord so that it will not injure the spinal cord, spinal tracts. It will not cause neurological deficits. So what are the advantages? It provides controlled and gentle retraction of the spinal cord tissue, minimizing the risk of damage to surrounding structures and nerves. It provides an improved visualization of the surgical site, allowing for more precise removal of the tumor. It reduces the complications. But what are the risks? If you are not careful, if you are not experienced, you can damage the delicate spinal cord tissue. And as with any other surgeon, infection, inflammation are common. Thank you.